So today we'll be doing chirotherapy. Specifically, we will be doing an ice massage. So a couple of things here. So indications, reasons why we would do chirotherapy. If someone had edema, acute inflammation, reasons why. So when we have an acute inflammation, when we apply that cold pack, it actually causes the metabolic rate to decrease. It decreases the rate of firing of the chemical mediators such as histamines, prostaglandins, and bradykinases. By decreasing these chemical mediators, we actually get vasoconstriction. Vasoconstriction gets caused and it decreases the inflammation symptoms such as redness, edema, and loss of function. So we have now two precautions and two contraindications we need to consider for chirotherapy. Two precautions would be if we had an open wound. The reason why we wouldn't really caution of it, because again, when you apply that cold pack or you want to do an ice massage on that open wound, it actually causes vasoconstriction, which decreases that circulation, and it could actually delay that healing. So that's something we just need to consider and monitor. Another one would be for, if they are, I forgot my train of thought, hold on. If they are very old or very young. So if we just need to consider this too, because they could have poor thermal regulation. So again, we just need to monitor those signs and symptoms of any abnormality show when we apply that ice massage. So those are the two precautions. Two contraindications would be if they had a cold intolerance or cold hypersensitivity. So a cold intolerance would be if they experience like severe pain, and a cold hypersensitivity would be if they had any type of rash that we would see in that process of doing an ice massage. Okay, so those are pretty much all the starters. Now we could get to our patient. So, good morning, Ms. Malinsky. How are you doing today?
How are you?
Great. My name is Monica Malinsky. I'm a student physical therapist assistant, and we will be doing an ice massage today. Okay? So we will be doing your forearm. So before we do your forearm, we just need to do a dermatome test, okay? So it will be ranging between T1, T2, and C6 to C7. Okay, so just get that here. Okay, so this is gonna be the cold, this is gonna be the hot. And if you don't mind, can you have your eyes closed for me and then stick your forearm just like this? Perfect. And then eyes closed, and then tell me if you feel hot or cold.
Cold. Hot. Cold. Warm.
Good.
Cold. Warm. Cold. Warm.
Perfect. All right. So she got a 3 out of 3 for the dermatome test. She passed, so she's actually ready to apply the ice massage. So we just need to make sure there's no jewelry or anything like that. And then we have a towel underneath, because when you apply the ice massage, water will be leaking. So if you don't mind, Benny, can you just move the camera here so she can see? Perfect. Thanks. All right. So actually, I'm gonna go get the ice right there. Okay. All right. So here is the ice pack, nice and cold. And some things to consider. So you will be going through the 5 stages. So we call them C-band for a reminder. So it'd be a cold, like an intense coldness, and you would feel some type of achiness, analgesia, and numbness. So those are the things to consider once you go through those stages. So mainly it take around like 5 minutes, 3 minutes. So we'll just start applying, and then let me know when you go through all those sensations. And that pretty much gives it the good effect, so we can stop. Alright, I'll just open up just like this. Okay, I know it's going to be a little shocking. We're going to do small circulations. I don't know if it's going to let me though, because it's not really real ice. Okay, let me know when you feel all those sensations. So once I will be doing this continuously for about 5 minutes, but you'll feel those sensations. You'll let me know. Do you feel any cold intenseness? You do? Okay, you're just being really calm
Yes.
right now. It's
Mhm.
yeah, it's not fun.
Very, no.
Yeah, I know. Sorry. Okay. So again, abnormal effects here would be some type of rash or a very severe redness. But so far, I don't see any type of adverse effects, so it should be okay. Alright, do you feel any achiness?
Mm-hmm.
Past the achiness?
Mhm.
Okay. I know it's not really comfortable. Okay. Alright. Achiness, the anesthesia, which is like a pain relief, and then you feel the numbness. So let me know when you feel numb. I'm not gonna torture her forever, but let's just pretend she went all the way through the numbness 3 minutes in. So then you would just use a towel. Okay, that's actually really cool. Use a towel and then wipe off any type of water that would be applied, and then you are all set.
Thank you.
Mhm.